Alright, hi everyone. So today we're just going to be doing a little quick overview of the portal venous system because I know it can be a bit confusing when you first learn about it. So essentially your body has two different venous systems that deal with your GI tract. You have your systemic venous system, which is I guess a system that we think about when we just think about veins in general. And we also have the portal venous system. So in this diagram here, you can see all the blue stuff is essentially the systemic system. And we also here just have a special bit just for the digestive tract. So you can see we have something called the hepatic portal vein that connects the digestive tract to the liver, and it sort of bypasses the systemic circulation. But once in the liver, it will then drain back into the IVC and join the rest of the blood. So this is a bit of a flow chart of where the blood actually goes. So from the GIT, it flows into the tributaries of the portal vein. So you can see here, and then into the portal vein itself, and then into the liver. And once the liver has done its metabolism and all that jazz, it essentially returns back into the hepatic veins, which are systemic veins, and then will drain back into the IVC. You can see here we have three main sort of big veins that will all converge to form the portal vein. So we have the splenic vein here, which drains the stomach mainly. We also have the inferior mesenteric vein here, which will drain the blood mainly from the descending column. And we also have the superior mesenteric vein here, which essentially drains the rest of the GIT. So it's important to know as well that the portal vein does not actually directly connect to the IVC. You can see here that the portal vein is a bit more anterior and it drains into the liver. Okay, so all the blood's draining in there. And then you can see here, there's some other veins, which are the hepatic veins that will then connect to the IVC and drain back there. And now we're going to talk a bit about portal hypertension. It will make a bit more sense this way. So portal hypertension is essentially when there's increased resistance to blood flow through the portal venous system. So this can be caused by prehepatic. So for example, the portal vein is blocked by a thrombus, so before the liver. Intrahepatic, which is a problem in the liver, for example, something like cirrhosis. Or we have posthepatic causes where the blood actually can't pass into the IVC for whatever reason. So all of this sort of makes a bit of a traffic jam in your portal venous system, and which is not a very good thing. You don't want all your blood just sitting there unable to get back into your systemic circulation. That would really not be good. So your body has come up with a different thing. Essentially, it's able to bypass this blockage through portosystemic anastomotic sites. So essentially the backed up blood will flow back into these sites and bypass the liver and go into the systemic circulation. This does mean though that your blood isn't detoxified by the liver, which itself can cause a bit of problems, but I guess it's better than sitting in your portal venous system. So the main complication with these anastomotic sites is that some of these sites can't really deal with the sudden increase in blood flow going back through them. And so to try and accommodate the volume of blood, they'll dilate, and in some cases they can actually rupture, leading to mass bleeding. So for your exams, there's only really 3 anastomotic sites you'll need to know. There are a few more, but there's only really 3 you need to know. The first one being the esophagus. So we have here, you can see this sort of purple colour. We have the portal venous here, which is the esophageal branch of the left gastric vein, anastomosing with the accessory hemiazygous vein. And here, what happens is that we get esophageal varices. So varices are just dilations of the vein. And sometimes they can rupture, leading to hematosis. So that's the vomiting of blood, and this can be quite life-threatening, as you can imagine. So important here to note is that this is frank blood, so just pure blood that's coming out, as opposed to something like coffee ground vomit that you might find in peptic ulcer bleeding. The next site we have here is the rectal site. So you can see from the purple portal venous system, we have the superior rectal vein anastomosing with the middle and inferior rectal veins, and this causes hemorrhoids. Very lovely. Had to go and Google images for hemorrhoids, so I'm doing you all a big service there. Next, we also have the paraumbilical site. So we have here the paraumbilical veins of the portal venous system, anastomosing with the superficial veins of the anterior abdominal wall of the systemic system. And this can cause what's called caput medusae. You can see here in this picture, this person has these superficial veins are a bit dilated. Interesting. Additional symptoms of portal hypertension include jaundice, melena, which is, if you know, it's sort of these black tarry stools, which are another sign of upper GI bleeding, splenomegaly, ascites, as well as the symptoms of the actual underlying cause of whatever is causing the portal hypertension. All right, so I hope that made a little bit of sense now, and you're all a little bit better equipped to understand the portal venous system. Thank you.